Anatomy of the esophagus. The esophagus is a muscular tube connecting the pharynx above to the stomach below. It is 25 centimeters long, but only 1.25 centimeters is in the abdomen. It passes through the esophageal hiatus of the diaphragm at the level of the 10th thoracic vertebra to join the stomach. In the neck, the esophagus lies in front of the vertebral column, and laterally it is related to the lobes of the thyroid gland. Anteriorly, it is in contact with the trachea and the recurrent laryngeal nerves. In the thorax, it passes downward and to the left through the superior and then the posterior mediastinum. The relations of the thoracic part of the esophagus from above downward are as follows. Anteriorly, the trachea, of course, and the left recurrent laryngeal nerve, the left principal bronchus, which constricts it, and the pericardium, which separates it from the left atrium. Posteriorly, the thoracic vertebrae, the thoracic duct, the esophagus veins, and the right posterior intercostal arteries, and at its lower end, the descending thoracic aorta. On the right side is the mediastinal pleura and the terminal part of the esophagus vein. On the left side, the left subclavian artery, the aortic arch, the thoracic duct, and the mediastinal pleura. The arterial supply. The upper third is supplied by the inferior thyroid artery. The middle one-third is supplied by esophageal branches from the descending thoracic aorta. The lower one-third is supplied by branches from the left gastric artery. Venous drainage. The upper one-third drains into the inferior thyroid veins, the middle one-third into the esophagus veins, and the lower one-third into the left gastric vein, which is a tributary of the portal vein. The lymphatic drainage. The upper one-third is drained into the deep cervical nodes, the middle one-third into the superior and posterior mediastinal nodes, the lower one-third into nodes along the left gastric artery and vein, and the celiac nodes. The nerve supply. The parasympathetic stimulation is from the vagi, and the sympathetic fibers are from the sympathetic trunks. Esophageal constrictions. There are three main esophageal constrictions which are important anatomically. The first is at the upper end, which is 6 inches from the upper incisors. The second is where the aortic arch and the left pulmonary bronchus cross it anteriorly. This is 10 inches from the upper incisors. Thirdly is where it pierces the diaphragm, which is 16 inches from the upper incisors. At these constrictions, foreign bodies can lodge. It can be sites for cancer, and strictures can form in these places if caustic fluids are taken. The lower one-third of the esophagus is the site of portosystemic anastomosis. In this place, esophageal tributaries of the esophagus veins, which are the systemic veins, anastomose with the esophageal tributaries of the left gastric vein, which is the component of the portal system. In case of high portal venous pressures, as in cirrhosis of the liver, which we call portal hypertension, there is increased backflow causing varicose veins. These sites tend to burst, causing hematemesis. The normal flow of venous blood is in this direction toward the portal vein and up through the hepatic veins into the IVC. But in portal hypertension, there is a reversal of flow because of the high pressures, and this ends up causing esophageal varices and hemorrhoids, and also caput medusae.